All right, everyone. So, welcome to our March 2025 virtual lunch and learn. This is our second part of our two-part series about trauma and attachment. So, I'm actually going to turn it right over to our trainer, Meg, and she's going to take it away, including a little bit of introduction about who she is. And then, Meg, it's all yours.
Great. Thanks, Lauren. So I am Meg Garey. I am Executive Director of A Better Chance for Our Children. And if you're not familiar with us, because you're brand new, we provide foster care, adoption, and post-permanency services throughout the state of Delaware and have probably worked with many of you. And if not yet, perhaps in the future. So I thank you for taking this time to learn with me today. I am going to do a little bit of an overview before we get started with the new content of what we covered last time and welcome questions. Lauren will monitor the chat, but you are also welcome to unmute and ask questions or comments. And as Lauren said before, just because it's being recorded, we'll be vague with details. But let me get us going with our slides and we will take it away. So our goal at A Better Chance for Our Children is to provide those services that I mentioned. And at the sort of heart of that is providing as much support as possible to our families because we know that they're doing the very difficult day-to-day caring for our kids who've encountered a lot of challenges in their lives. And as an organization that was founded by adoptive parents, their lived experience really informed our mission and our goals. And so this training, this spending time with folks who interact with our families is a big piece of what we do. It's a part that I love of what we do, and it is knowing that the professionals and the parents who are supporting our kids will always benefit from ongoing information, just as I do. I love having that learning mindset. So thank you for taking this time. Um, we are brief overview of part one. We talked a lot about grief and loss, which are at the heart of the adoption and foster care experience, and the need to help our kids have space where they can acknowledge their grief, talk about their losses, and work through them. Often, our kids won't be able to acknowledge and name those for themselves. So, making sure they have the right support to do that is huge because sometimes we'll hear from parents or providers of, well, they haven't asked about it or they haven't mentioned this. But we know that that is no indication that it's not on their mind. And so we want to give them space for that. There are some core issues that often cause some challenges for our kids. And so we went through those. Rejection is often a very sensitive button and it can be surprising. um, Things that you wouldn't think a child might take as rejection, but because it is such a sensitive area due to feelings of their own sort of early life losses and perceived rejection and abandonment, feelings of guilt and shame around their current situation, around their family, around what has happened in their family or what has happened to them. We're going to talk a little bit more specifically about identity today when we talk about transracial adoptions and foster care experiences. But identity in general can be a really big challenge for our kids because they're left with a lot of questions around, who am I supposed to be like? Where should my loyalties lie? Given my whole, history, my life up until now, and all these different parts of me, what does that mean for who I'm going to be? So that's hard enough when you're a teenager, but there's just some added layers when it comes to our kids. Mastery and control are also big areas because our kids, one, often lose opportunities to develop a sense of mastery and competence because of their experiences and challenges, and they do lose a lot of control. We know that. We know that. And they don't always understand everything that has happened to them. And one of the ways our kids often protect themselves is by trying to be take control wherever they can, try to be in control. And sometimes those are ways in which we don't find as helpful, but make a lot of sense in their defense brains. I listed rejection twice. So the last one is intimacy, and the idea that we think about what we need to be in an intimate relationship, whether that's physically intimate or romantic or just a vulnerable, close relationship like a friendship. We need to be able to trust someone. We need to be able to be vulnerable. We need to be empathetic. We need to have a decent sense of social cues and sort of the give and take. And for our kids, a lot of those components can be difficult. They don't necessarily have those skills or that capacity. So intimacy can be a big challenge. It can also be a challenge because sometimes our kids also dive too quickly into relationships and share everything within 5 minutes of meeting, or want to be as close as possible, as quickly as possible. And that is a challenge, just as the distancing that our kids do can be a challenge. So that early trauma that we talked about, it impacts their brain development and the view the child has of, who they are, how they view others, and just how they view the world in general. Because their brain is always, our brains, all of our brains are always assessing for safety. And they're doing that by assessing inside. So what is happening inside my body? Do I have a need? Do I have a headache? Am I tired? Is there a pit in my stomach because I'm nervous about something? What's happening within my own body? Am I feeling jittery? Assessing safety outside is, what stimuli do I need to pay attention to? What's that moving over there? What's that sound? And so constantly assessing and taking that in. And then between, assessing safety between, is that with another person. So if I, walk up to one of you right now and you have a sad look on your face, I need to be thinking about what's going on. Are they sad about something I did? Did something happen to them? If you have a mad look on your face, I might be on alert, because my brain is thinking, all right, that person's angry, so I'm not sure if they're going to be angry at me or direct that toward me, so I need to be on alert now. And our kids often are on super high alert, because their alarm system is perhaps more hyper vigilant, because they've had to be more hyper vigilant. They've had to learn that protective measure, to be very aware, to be wary because of the experiences they've had. And so they are able to they are are able to and do react very quickly when there's a potential threat, which we talked about felt safety, which is tricky because it's subjective. What feels safe to me might not feel safe to you. And so we might not recognize the safety threat that our kid is experiencing. So we have to keep in mind that there's something there, even if we can't readily identify it. The other thing that we have to keep in mind is often I'll hear from parents or folks around, well, they're 9, like they should know better. They're 9, they should be able to. And the reality is our kids, developmental age doesn't always match up with their chronological age. They may be at an, emotional development level of maybe a 5 or 6 year old, a social skill level of a, 7 year old, even if they're chronologically 9 or 10. And so I often ask folks to step back and think about, like, okay, you're saying they should be able to do X, Y, and Z, or you're frustrated because of X, Y, or Z. All right. So if we break that down, like, what age does it feel like they're at when they do that thing? Like if it's a toddler type tantrum, then that might tell us that their emotional processing ability is closer to the age of a toddler as opposed to their actual chronological age, which means we need to support them in building some skill and capacity if possible. And we need to adjust in the meantime to where they are. And we might have to accept where their capacity is and they might not catch up in every way. And we're going to talk a little bit more about some challenges that can impact capacity today. And then we have to, there's a reason why I like talking about the brain and why we spend a lot of time on the brain is because we really can't understand what's going on for our kids until we know what's going on in their brains, what is happening. And we have to know that for ourselves as well. So I'm going to pause real quick. I know that was a sort of fast overview, but did anyone have any sort of thoughts or questions just based on that review?
Hey, this is Linda Busaka. I have a quick question.
Hi, Linda.
Can you hear me okay?
Yep.
I just wanted to know when the age of the child and their behavior is, at a very great distance, meaning they might be a 15-year-old and they're, acting like a toddler. Are there any thoughts on that? Like how would we approach that differently or
Sure.
any thoughts on that?
Yeah, so just how to help that 15-year-old when they're having a toddler-like tantrum?
Yeah, basically that. Yeah.
Yeah. So a little bit without like truly speaking to them like a toddler, I would think about how do we respond to toddlers when they're having tantrums? Often we are more patient than we are with a 15-year-old. I would try to give them some space and shift my expectations for their ability in that moment to come down, and would go back to some of what we talked about last time in terms of if we're going to approach a situation where somebody is elevated, we need to make sure they are regulated first. So how do we help someone regulate who's at a toddler level of regulation? Because toddlers can't just like take a deep breath and calm themselves down. I mean, sometimes they can. But often we help them do that. We co-regulate. And so thinking about how you can co-regulate a 15-year-old in a way that doesn't feel like you're treating them as a child, but taking the same principles and applying them. So I would sit with, I would try to encourage some deep breathing if they can in that moment. I would be playful if I can in that moment. It depends on what that 15-year-old is open to and what works for them. But it really is about seeing it as like, we see toddlers have tantrums and recognize that that's typical for their age. They can't really regulate themselves. And so seeing that the same way in a 15-year-old, that like they can't regulate themselves right now, even though we think they should be able to because they're 15. So those are some brief thoughts. I don't know.
That's very helpful. Thank you.
Absolutely. Anything else? Okay. As things come up, of course, you can put it in the chat, or if something comes to you later, please feel free. We are going to watch the video clip that we didn't get to last time as a nice little wrap up of our sort of overview. And it's a nice time to think about what the brain is doing and sort of who is at the controls. So I'll just ask someone to let me know if the audio is okay.
Is acting so weird. Why is she acting so weird?
What do you expect? All the islands are down.
Joy would know what to do.
That's it. Until she gets back, we just do what Joy would do.
Great idea. Anger, fear, disgust. How are we supposed to be happy?
Hey, Riley, I've got good news. I found a junior hockey league right here in San Francisco, and get this, tryouts are tomorrow after school. What luck, right?
Hockey?
Uh-oh, what do we do?
Guys, here, you pretend to be Joy.
Won't it be great to be back out on the ice?
Oh yeah, that sounds fantastic.
What was that? That wasn't anything like Joy.
Because I'm not Joy?
Yeah, no kidding.
Did you guys pick up on that?
Sure did.
Something's wrong. Should we ask her?
Let's probe, but keep it subtle so she doesn't notice. So, how was the first day of school?
She's probing us.
I'm done. You pretend to be Joy.
What? Okay,
It was fine, I guess. I don't know. Oh, very smooth. That was just like Joy.
Something is definitely going on.
She's never acted like this before. What should we do?
We're gonna find out what's happening, but we'll need support. Signal the husband.
With a nice pass over the reed, comes across that right.
Uh-oh, she's looking at us. What did she say?
What? Oh, sorry, sir. No one was listening.
Is it garbage night? We left the toilet seat up. What? What is it, woman? What?
He's making that stupid face again.
I could strangle him right now.
Signal him again.
So, Riley, how was school?
You gotta be kidding me. For this, we gave up that Brazilian helicopter pilot?
Boo! I'll be Joy.
School was great, all right?
Riley, is everything okay?
Sir, she just rolled her eyes at us.
What is her deal? All right, make a show of force. I don't want to have to put the foot down.
No, not the foot.
Riley, I do not like this new attitude.
Oh, I'll show you attitude. No. Stay happy!
What is your problem? Just leave me alone.
Sir, reporting high levels of sass.
Take it to DEFCON 2.
You heard that, gentlemen? DEFCON 2.
Listen, young lady, I don't know where this disrespectful attitude came from.
You want a piece of this, Pops? Come and get it!
Yeah, well...
Here it comes. Prepare the foot.
Keys to safety position. Ready to launch on your command, sir.
Just shut up!
Fire!
That's it. Go to your room. Now.
The foot is down. The foot is down.
Good job, gentlemen. That could have been a disaster.
Well, that was a disaster.
Come, fly with me, Gatinha.
Okay, so not only is Inside Out delightful, it really is a great like emotional intelligence resource. Hopefully you're familiar with it. If not, I highly recommend it, and part two. And I really like the idea of thinking about like who is at the control, not just for our kids, but for us, right? Like where are we in our brains? What is who is the driver in this moment? And for our kids, we have to remember that there are times where they just are going to have less control based on who is pulling the lever. So any thoughts or questions around that? Just a little delightful time with Inside Out.
He's acting so weird.
There we go. Okay, so we are going to shift gears and talk about one of the other challenge areas for our kids, which is prenatal exposure. So the prenatal experience really does impact our kids as they grow and once they come into the world. And so we need to hold on to what is happening for them during that time. And so often our kids have been prenatally exposed to substances, and we're going to talk about the impact of drugs and alcohol and stress hormones. So I highlight those as well as like cigarettes or other substance like chemicals that could be ingested because they all have a different impact on how a child's brain is developing and how their body is developing. Some of the challenges we have is we don't always know. So we don't always know what a child experienced, and so what the exposure may have been and the impact. We often don't see an impact until a child is closer to school age, because a lot of the challenges are around capacity that are typical for toddlers. We don't expect toddlers to be able to remember instructions, to regulate their emotions, to shift activities easily. And it's really once our kids get older and are expected to do more that we might recognize these challenges and start thinking about if they're related to prenatal exposure. And so the impact of the exposure really, it does depend on what is used, when it was used, and how much was used. So we talked last time about brain development. So the brain starts its development at 5 weeks after conception, and the basic structures are in place pretty quickly. And so depending on what was developing at the time of use, and again, how much was used and what was used, those are the factors that dictate the impact, and which is another reason why it's really hard to know. We can't really predict it because we're not going to have those details. And when it comes to stress hormones, I often ask folks to think about, what do we know about a child's prenatal experience? And often, parents will say, well, there was, they were tested at birth, there were no drugs. So like, that's not a problem. Like, okay, great. So that means they didn't use any drugs. It doesn't mean that they didn't use something else, or it doesn't mean that they didn't use it, but at the time of birth, it didn't show up. And so we can't assume that just because a test at birth doesn't show something, that they didn't experience an exposure that is impacting them. And so I also ask parents to think about, like, what do you know about a child's prenatal experience? So, or what mom was experiencing during that time. So was she in a violent relationship? Was she struggling with stability in terms of where she lived or having a job? Because was she experiencing severe mental health challenges? All of those are big stressors that are going to cause mom to have more stress hormones in her body that then flood the baby. And so flooding stress hormones into a baby's developing brain tell that developing brain, you got to be ready for stress. And so that's how the baby comes into the world, with a brain that's wired for that in a different way. So for some of our kids, there will be no effect ever seen. For some, they will have early struggles that will improve with age. And for others, it's going to be a capacity challenge that will impact them for the rest of their life. And we have to always remember that from a physiological point of view, if there was that prenatal exposure to drugs or alcohol, might be then predisposed to substance use in their own life, physiologically and perhaps genetically, because we know that those challenges can be passed down. So there are a lot of things to think about in terms of what we're seeing and how we might need to talk to our kids, because for some of our kids, we're going to have to prepare them for those teenage years in a different way, because they're going to have to be very aware that their body is going to respond differently to substances than a peer's body might if they came into this world exposed. So neonatal abstinence syndrome is one that many of you are probably familiar with. It is something that a lot of our kids have experienced, and it's most typical when opioids are used during pregnancy, and it is a group of symptoms that we'll talk about. And there can be a short-term impact or potentially a long-term impact. So here are some of the symptoms that may be seen for NAS. They can show up really early on, and a lot of them do subside around 6 months-ish. They can last longer, but a lot of them do subside after several months. But some can stick around. And so you've, again, probably known foster parents who've been caring for those babies who, it's sort of impossible to get them down to sleep, or that they have very stiff bodies, or again, the sort of high-pitched cry. And so recognizing the impact that that's having on the tiny body, and also thinking about our kids and their experiences if they had to stay in the hospital for a period of time after their birth. So as we think about attachment challenges, and as we think about a child's really, really early experiences, we need to think about time when a child was in a hospital for 1 week, 1 month, 3 months, 6 months, and what that did to their developing brain. Because while they're getting good care, it's not the same as having a caregiver who's taking care of your need day in and day out. And so that experience we also need to hold and think about how it might have a future impact. Thoughts or questions about any of that thus far?
We do have one comment in the chat.
Yep. Take a look. Let me see. Okay. 18 high school, moved to independent, not really 18 years. Okay. Yes. So what I see is your thoughts on an 18-year-old high school graduate moving into independent living, but not really 18-year-old in terms of their mentality closer to a 15-year-old. So what I would say is seeking any evaluations that assess their capacity and cognitive ability. Also determining what supports can be put in place and recognizing that whatever team they might be working with, hopefully they are working with, like the independent living team, understands their capacity challenges, because this is a tricky one, because a lot of our kids, they don't fall into like an IQ level that says that they have cognitive capacity challenges, but they do have capacity challenges, either in how they are processing information, their emotional abilities. And so making sure that whoever is on the team understands that they are not functioning at the level of an 18-year-old, and we need to shift expectations and supports accordingly. Even if like testing doesn't say that they are at a lower level, but if it's what you're seeing, you just need to advocate accordingly. Hopefully I answered that correctly. Any other thoughts or questions? Okay. So we're going to move on to specifically talk about fetal alcohol spectrum disorders. So FASD is how I'm going to generally refer to it, which is the umbrella under which these categories fall. And what I will say is research around prenatal exposure, obviously, it's tricky business, because while we can do as many experiments as we can, we're not doing them on babies. Right? Like, it is hard to know a lot of this and know the full impact. But generally speaking, the understanding now is that exposure to alcohol during pregnancy has a more significant negative impact than exposure to drugs. And so the challenge here is we don't test for alcohol upon birth. We test for drugs. And so we don't know. And because this isn't common knowledge, I would guess that if a pregnant woman is trying not to use drugs during pregnancy, that would be very difficult. And they might take the edge off with alcohol, not knowing that it's worse. They might think it's better because alcohol is legal. People do it every day. Even some doctors say it is okay to have a glass of wine or something during pregnancy. Generally, it should be a sort of zero amount because there are so many unknowns. But we assume that if a woman did test positive for using substances, that alcohol was also used. So let's talk about like what FASDs look like. So this is where this is why it's more significant, because it can cause actual brain damage. So while substances will impact the way the brain develops, again, depending on the substance, depending on how much is used, depending on when it is used, for alcohol, it can cause actual brain damage. So it is a brain-based disorder. And it's not that it will get worse over time, but there may be capacity limitations that will not change. And as I said earlier, we might see that the challenges become more significant because more demands are being placed on the child, and therefore their capacity limitations are causing bigger problems. So our kids who fall into this category struggle in a number of ways. They are going to have a harder time discerning facial expressions, navigating social situations, understanding body language, understanding boundaries. So we work with a consultant, Dan Dubovsky, who does training for us frequently. We had a series this year about FASDs, and he raised a son who had FAS, fetal alcohol syndrome. And so he had some pretty big challenges, and Dan tells many stories that illustrate that. So in terms of understanding boundaries, Dan was speaking at a conference, and Bill had a question for Dan and found Dan, and Dan was on the stage speaking, and Bill walked right up and asked him his question. Now, people who don't understand that would be like, that's so rude. Why would he do that? Does he not understand? He doesn't understand. Like, he does not understand that boundary. It's not he doesn't care about the boundary. He literally does not understand that is an inappropriate step to take. And so we need to remember that it is a capacity challenge. They'll have a hard time focusing, understanding cause and effect, and deciding what's safe. So Dan would also tell the story of Bill. They grew up in Philadelphia. He's like, we needed to be safety conscious. So I would tell him, Bill, like, you cannot talk to strangers on the street. Not everyone, you meet is a friend. Like, you cannot talk to strangers. And then Dan finds Bill on the street talking to someone he's never met. He's like, Bill, what have I told you? You can't talk to strangers. He's like, he is not a stranger. He told me his name is Steve. And in Bill's mind, like, that was it. Like, he's not a stranger. He told me his name is Steve. Like, now he's my friend because I know his name. That is not oppositional. It is genuinely his understanding. And then the short-term memory and working memory are often impaired. So if we're going to have a kid who we send upstairs to get ready for bed, and we list the 5 things they need to do, including go upstairs, brush your teeth, wash your face, get out your clothes for tomorrow, put on your pajamas, and pick a book, right? They're going to get upstairs and maybe get to brushing their teeth and then wander into their room and start reading. And you're going to come up and say, Bill, why did you not follow the directions? So Bill is either going to say, because he genuinely doesn't remember, or I didn't feel like it, because he doesn't remember and doesn't want to say that. I didn't feel like it. And it is an actual capacity challenge where the working memory is not there to keep a hold of all those tasks. So we have to adjust expectations and supports and break things down in a different way. Use visuals and shift our expectations. And if you think about that, think about a kid in school and how much memory they are asked to use, how much processing they're expected to do. And so they often have significant challenges in the academic setting. And also just think about how much sensory overload there is in schools. So that's also something that can be hard for our kids who fall into this category, is that there are just too many things. So Dan often, what he suggests is sort of limiting choices when possible. So even like in a kid's room, to keep not all of their clothes at once. You can have a rotation of in and out, but like they have 5 shirts at a time. And then you can move more shirts in, right? But because having all 20 of your t-shirts in a closet can be really overwhelming when trying to make a choice. Okay. That was my abbreviated review of fetal alcohol spectrum disorders. I'm going to pause and see what other sort of thoughts or questions folks have around prenatal exposure.
Hi, Meg. My name is Laura. I'm just looking at this and I don't know the background of exposure for one of the kids I work with, but would kids who fall into a category of exposure maybe be misdiagnosed with things like oppositional defiance and ADHD, or is that just how they define the challenges as a result of this kind of exposure?
So our kids are often misdiagnosed. Um, Sometimes it looks like autism.
Mhm.
Sometimes it looks like ADHD. Because there's a trauma layer that also impacts these things.
Mhm.
It further complicates it. We actually have a chart that lists like symptoms this way and all the possible diagnoses this way, and then sort of going column by column. And you can see how similar some of them are and how easy it is to be misdiagnosed, especially because getting an FASD diagnosis is very difficult.
Mhm.
Um, and it's not something that everyone understands or has on their radar.
That makes sense. That was helpful. Thank you.
Absolutely. And so one of the things we say to parents is like, listen, you're not going to know. And that's the hard part. Like for all of the challenges we're talking about, you're not going to know what's just typical child stuff that a typical 8-year-old does when they're having a bad day, what's related to trauma, what's related to prenatal exposure, what's related to genetics. Like you're not going to know. The
Yeah.
upside, I suppose, is that most of the things, apart from medication, like medicating a kid for ADHD that doesn't have ADHD is just going to cause some challenges. Um,
Mhm.
but apart from that, a lot of what we suggest and a lot of the approaches will fit regardless of what the cause is. Sorry, Laura, did you want to add anything else? I didn't mean to.
No, no, that was awesome.
No, that was great. Yeah, I that clears up a lot in my brain for my own
Yeah.
understanding. So thank you.
Yeah, absolutely. Absolutely.
And
I'm
Meg, there's
also
one more question in the chat when you get a chance.
Yes, excellent. I'm also happy to send some follow-up information. Um, so do foster parents get a chart on these symptoms if they're told the child, sorry, things are popping up. Go away. Um, why are you okay? Told the child was born with FASD. So, um, I cannot speak to all of the families and the information that is given. This is information that we give to any parent who is going to be a foster parent for us or is going to adopt so that they have the general knowledge around FASD. Um, if a child is born substance exposed, uh, again, they don't test for alcohol use. We just assume it. Um, and so they're likely not given any information about FASDs at time of birth, but it might depend. Oh yeah, okay. Yay, Lori. If you want to say anything else about that, Lori, please share. Because it's not my area. But if it is known, that's great if information is provided.
Can I ask a question?
Please.
Oh, yes. So if we know that a child was born and tested positive for drugs, are they automatically entered into like your birth to 3-year-old programs, or do we have to like mention that or ask for those resources?
So I would say generally the Division of Family Services, that worker would be doing those pieces along with the foster parent. But that would be their role, yes, to make sure that those services are in place. If they are not in place and you have a concern, I think it's certainly reasonable to say, hey, I was wondering, like, would they benefit from an evaluation given this history? Because we can't expect everybody to get it right every time. So yeah. Anything else? Sorry, the chat pops up over here, so I'm just trying to. Perfect. Thank you, Lori. So much information. So helpful.
Just a quick question. Has there been any thought of making alcohol levels a part of newborn screening?
So I can't speak to sort of the medical. Okay. Lori, do you want to say anything else? to test the meconium, I believe, is what is necessary. And it was my understanding that it is not typically tested, but perhaps I'm incorrect. Oh, the urine drug screen on mom. Okay, so yeah, so that's a little different, but yeah. So not the infant. So we'll know if mom was using recently, but we won't necessarily know about the child. Yeah. Okay. All right. Well, that's great info. All right. I'm going to see if there's anything else. Okay. All right. Okay. So we're going to hop into talking about identity.
Can I just ask a quick question? This is Joyce.
Absolutely.
Do you think that multiple hospitalizations during the early stages, like maybe within a year, 2-year-old, that could be some like trauma? Is that considered a trauma? Because hospitalizations due to illnesses.
Sure. So I would say that those are significantly stressful experiences. So yes, like those stressors would absolutely have an impact on a child at that early development, like that stage of development. I think you're saying like birth to two, multiple hospitalizations. Yes, I would say that would be a significant stressor that could impact them, and it would depend exactly what that looked like. I mean, I couldn't really say more without knowing details, but what I would think about is what does each of those look like? Do I have a person who stays with me? Do I not have a person who stays with me? Am I receiving a lot of pokes and prods while I'm hospitalized? Am I in pain? Are there a lot of procedures? All of those things are stressful. So depending on what it looks like would sort of dictate the impact.
Okay, thank you.
Yeah, sure. Other thoughts? Okay. So identity. We started talking about it a little bit. We're going to talk about it a little bit more because we want to think about, and just in general, you can think about this for yourself. Like if you were asked, like, what are all of the components that make up your identity? Things would come to mind for you. You would sort of start making a list. So what are, sources of identity? So often, it's race, culture, status, communities, um, uh, even like groups you're a part of, things like that. What does our identity give us? So it can give us lots of things. It can give us a sense of belonging. It can be protective. It can also be a risk. Some aspects of identity can put people in harm's way. And so when, why, and how do we need to address identity with our kids is sort of the same as like when do we talk to kids about foster care and adoption? Always, like they should always know, this should always be a part of the discussion because kids start sort of forming their ideas about identity, about other people and where they fit really early on. And so we want to be a part of that part of that discussion. So specifically, we're going to talk about fostering and adopting transracially, because that is an added layer for a number of our kids and families. And so what we ask parents to consider is that they think about how they are viewing their family. So it is now going to be racially or culturally different than it was. They have to be aware of their own racism and biases. How will your child experience your extended family? The founder of our organization, Mary Lou Edgar, she and her husband Dan, 5 children. 2 joined them via birth, 3 joined them via adoption. One of their children, Mani, they adopted from India. Dan and Mary Lou and their families are pretty Caucasian. They're like their families. And Mani is Indian. And growing up, when they would visit Mary Lou's mother, she had pictures of the white children of the family. She did not have pictures of Mani up in the house, and so it was something that was very difficult because Mary Lou's extended family, her mother, one, she wasn't on board with adoption in general, so it wasn't necessarily just racism and that bias, but that was a very hard experience. And so if you think about like how does that impact a child's identity formation, um looking at your world, your community, your neighborhood, your family through the child's eyes. What does it look like when they go to school? What does it look like when they go to your church? What does it look like when they're on the soccer team? And then how will parents handle if there's teasing, name calling, rejection, questions, things like that. So when Mary Lou went to Mani's kindergarten class to read a book, because you have parents come in and they read their little book. One of the little girls in class said to Mani, well, like, that can't be your mom. You're not the same color. And Mani punched the little girl in the stomach. She did not appreciate that. She disagreed. So if families are going to foster or adopt transracially, they really have to think about, are they okay with the looks, the questions, being the center of attention? And what about the other members of the family? Like if you already have children in your family, how do they feel about that? Are they going to have a hard time if there are looks and questions and if it's standing out because they're different? We have to think about them as well. Because children in transracial families, they will stand out, they will be asked questions, and they will grapple with losses that come from that separation from their race and culture. And so we need parents to be very intentional about how they will honor a child's race and culture. And not just in what we call sort of passive ways, the passive consumption, especially for adoptive families. I think this is true for foster families as well, because they can be caring for kids for a very long time. But very true for our adoptive families to not have just, well, we go to the parade, we go to a museum, but how do they really integrate into their child's culture of origin? It's a really important consideration. Because a strong sense of racial, cultural, ethnic identity is protective, and it's a risk if not. And so often what we have is a person of color in a white family, in a white community. And what does that mean for them? And they might not have the same ability to manage the racism that they'll experience as they would if they had been raised in their culture. And so adoptive parents have to be really intentional about that. And we have, an adoptive parent who works really closely with us, and he's a white man who adopted an African-American boy and who is now 21, 22. He's no longer a boy. But this parent talked a lot about being so nervous when he started driving, when he was out in the world without him, and he had to really prepare him for what he was going to experience. And so the parent was very intentional of making sure that his son had as many resources and people as he could talk to, and that he himself, the parent, was educating himself and making sure that he was providing his son with the information and preparation that he needed. So what we encourage is that any family considering transracial adoption or foster care, that they think about their community now, their world now, and start building diverse connections if they are lacking. Not just, okay, we've added so-and-so to our family, so now we're going to go out and find a diverse group of friends or a diverse community. That doesn't work so well. You want to have some deeply rooted. So, thoughts or questions about transracial foster care, adoption, identity in general? I'm trying to keep an eye on time, but Lauren knows I'm not always the best at getting through things. Hence the 2 parts and the hour and a half, because there's so much. Okay, I don't see anything in the chat, so I'm going to move on. But again, if I move on too quickly, feel free to just shout it out. All right. So we are now going to talk about attachment more specifically. We've talked about it a little bit, but we really need to think about, we come into this world wired for connection. Like that is what our brains are here to do. And it's because we're helpless little babies. Like we have to be taken care of by bigger people. So we have to have that ability to connect. We have to seek that. So we come into the world wired for it. And so this is where it gets to be challenging for our kids because our brains are wired for connection. We all have attachment systems in our brains. There are hormones in our brains that help with attachment. They're chemicals, but trauma rewires the brain for protection. That's why healthy relationships are difficult for wounded people. Just looking in the chat. Oh, there you go. I'm just going to let that one go then. Thanks, Lauren.
I'll actually, if you don't mind, make it just a quick little announcement.
Oh, please.
These are some really great questions about neonatal, like neonatal substance exposure, what happens in the NICU, all sorts of medical focus about substance exposure. And Lori Nestor, who is one of our CASAs that's on our call today, she actually is a neonatal nurse and is going to do a presentation for us. I think it's in July. I can't remember exactly which month, but it's later this year as a lunch and learn. So that focus is going to be more about exposure to substances and then how the hospital treats it, who is tested for what, and then what does exposure look like, and then what should foster parents know. So stay tuned for that training because that's a whole nother training that's going to be an hour filled of lots of information. So Lori, thank you.
Excellent. It is nice that there are so many topics that you guys have the opportunity to immerse yourselves in because as we've talked about, man, this is varied. There's so much to consider for our kids. So I think that's awesome. And Lori is obviously a great resource. So that's very cool. Okay. Attachment. We come into the world wired for connection. It is our foundation. It's our foundation for how we grow and learn. It is our foundation for how we view ourselves, how we view the world. And so the negative impact that attachment challenges can have can be significant. And what's great is that these are things we understand now that we didn't understand a long time ago, where we thought if something happened before sort of conscious memory, like it's going to be okay. We could move kids as frequently as we needed to. We could, or if a trauma happened, like they're not going to remember it. So it doesn't matter. But the reality is it lives in their brains and bodies. And so it does matter. It does. But as I said, it's great that we have a better understanding of that. So we have a basic cycle, right, that we've all seen play out. Let's think about babies first, because that's the easiest. Child has a need. I mean, if you're a baby, you generally express your need by crying. So baby cries. That's the communication of the need. The caregiver takes an action to meet the need, generally, if possible, quickly, generally with some nurturing. And then the baby experiences satisfaction and then relaxation and then trust and confidence develop. Because me saying I have a need, expressing that need and having it met means like, okay, I can do it. We'll be okay. The next time I have a need, I will be okay because I will be able to say, I have a need and I'll be able to express it. I will get that need met. I will experience satisfaction and round and round and round we'll go. And so that is very helpful with the development that our brains need. They need that positive cycle. And so great. You know, when this goes well, love it. They learn I matter, they learn some attunement. And let me say, it's not that this cycle has to go perfectly every time. Like, we're not always fully attuned. And sometimes the baby has a need when you're on 95 and you can't immediately change the diaper, give them the bottle. They have to wait. And that's okay. Because then they also develop distress tolerance, which they also have to be able to do. So we don't need to meet the need 100% of the time. We just want to be able to do it the majority of the time and to be doing it in a nurturing way. Now, sometimes this doesn't go so well, and a child expresses a need. Let's go back to babies again. Cries, that's the communication, and then the caregiver fails to meet the need. And this is like a failure to meet the need, not a delayed, but a failure to meet the need. And then the child experiences fear or apathy, because if this happens enough, the child starts to feel like, all right, well, you know, I'm not going to get my needs met. That will lead to anxiety and feelings of stress, and then will lead to, as opposed to like, yay, I'm going to get my needs met, distrust, rage, no sense of safety, predictability, or value. Instead of the learning I matter, they learn I do not matter, if this is a cycle that they experience again and again and again. Now, we've been talking about babies. Let's age that up, because this is the cycle that happens with kids as well. They have a need, they communicate that need, and then we try to meet it. What gets to be tricky with a lot of our kids is that they're, excuse me, give me one second. Okay. I think it's just that allergy time of year that everything's a little, they don't always communicate their need in a very clear way. And so sometimes they're with adults who are trying to meet their need. They want to, they're here for it. But the child doesn't have a great sense of their need. They're communicating in a way that isn't really clear. And so then they get stuck in this cycle. Which is a big challenge, which is why we really talk to our parents about like being really thoughtful about what are they seeing in their child and what might be going on. And not just seeing a behavior, but see a need that is being expressed and trying to figure out what it is. And again, sometimes it's just falling back to the basic skills that we're going to talk about in just a little bit, when we don't know exactly what the need is. And often what our kids need is connection. But as we talked about last time, connection can feel very threatening. So there's going to be a sort of push and pull around it, because they're going to want it and then not want it, and want it and then not want it. So it makes this attachment cycle very difficult. And so we try to encourage parents to think about the need to create that bond the same way we do with infants and toddlers, even when with our older kids. Now, no, we're not going to like hold them and coo at them because they're not infants, but we're going to be attentive. We are going to be a good audience. We are going to try to figure out what their need is, because that's what we do at the beginning of a relationship. And so thinking about that attachment cycle and meeting needs in a way that sends a safety message. Again, going back to that felt safety. So even if it is something simple about like a kid wanting a snack or needing a new book bag, right? Meeting that need in a way that's, yes, like I understand that need, I respect that need, I want to meet it. Now I'm annoyed by your request, right? Sometimes we're annoyed by the request for a snack, or because they need a new backpack because backpacks are expensive. To try and meet those needs in a way that expresses the care and that safety and security. So ways to bond. These are, again, any age, any stage. Eye contact. So we added put that phone away. some of you might be familiar with the still face experiment. And the idea is there's a toddler age baby, like in a car seat. The video we use, mom is, engaging with child and then turns away and then turns back and has a completely flat expression. So it just goes completely flat. And you watch the baby continue to try and engage the way that they typically would, right? Reaching out, making noises, pointing, doing those things. And then you watch the baby devolve because they're not getting anything from mom. So at the end of it, baby is crying because baby has like just kind of collapsed into this feeling. And then mom turns it around, or mom re-engages and is able, they repair and they're fine. But the modern, like the everyday still face that we do is looking at our phones. Like we do this to each other. It is a conversation that I have in my household from time to time. Because if I'm talking and you're doing this, it sends my nervous system right on up. And maybe that says more about me than it does about, I don't think it is. I think it actually is something we all experience, right? So put your phone away. Be a good audience, right? Listen, show interest, engage. I have a 16-year-old who talks to me a lot about math. I gotta tell you, I do not care about math. They also talk to me a lot about all the reptiles that they love and want to have. I don't care about snakes. I don't like them, but there is one that lives in my house and it is okay. And I engage with that snake and with my 16-year-old because that is what we need to do. It doesn't matter that I don't care about our snake. I mean, I do. His name is Asparagus. So gentle touch. Now, this can be a tricky one because not all of our kids are open to touch. But if parents can find a way, it can be really a nice opportunity. Movement, again, this doesn't have to be, right, like what we do with kids, but like, is there a park near your house that has one of those slider like benches that you can sit on, right? That's rocking. You're not in a rocking chair, but you're doing it. Maybe you go to the trampoline park together and you bounce around. Again, just the smiles, the affection, nurturing, especially taking advantage when kids are hurt or sick, because often they don't have much of a choice for us to sort of get on in there and provide some additional nurturing. So we suggest that parents take advantage of that. And then shared control is just that idea of the less we can get sort of stuck in power struggles, the better off we're going to be. And I always think of like, what would you want in a relationship? I would want all of these things in a relationship. It doesn't matter that it's parent and child. It's what you want in a relationship. You want shared control. You want attention. You want affection. And so let's give those things, the same things we would want, let's give them to our kids. And so our parents and primary caregivers are supposed to be our safe base, right? They are who we return to, who we launch from. And for our kids, that disconnection really makes it difficult because they don't have that. They don't have any place to go. Or the place that they had been going had been very scary, or inconsistent or hurtful. And so it now means that I don't know that I can go to anyone as a safe base because of my previous experiences. So this is what sends our kids into that survival mode, that defense part of their brain that we talked about last time. So there are other factors that can complicate. It's a very long list. Sometimes it's just where the child is at. So one, their own history of trauma, their fantasies about reunions. So they may be less open to attachment because they're still hoping that there's a way where they'll be reunified, or are only remembering those good times. We have, sometimes there are just those control issues. So again, if you think about being in a relationship, it's a give and take. And so letting go can be really difficult. I'm sure some of you have seen this, these kids who were responsible for parenting their siblings or their parent, right? They often have to take on that role, and it's very hard for them to let go of that, to be parented, because parenting and taking care of everyone else and being in control is what kept them safe. So when we're asking them to set that aside, we're really asking them to like take a layer of armor off. And that can be very scary. And so we need to do that carefully. Sometimes our kids will attempt to sabotage relationships. Sometimes trying to connect is different just because we're very, like, if you're very different from a temperament point of view. So, if you think about me in a relationship, you're seeing me at my like performing Meg, but I am, often I can be, I can be up. Someone might not like my vibe, right? They might think I'm too much, or I'm too loud, or I like too many puns. I don't know. But if we have that mismatch, it's going to be hard to develop that bond. The racial and cultural differences we've talked about, lack of support. So it can be very stressful. And then we ask our parents to reflect on their own attachment experiences and their attachment styles, because those can be at conflict sometimes. So the separation from biological family, whenever it happens, however it happens, is a significant challenge. We've already talked about the need to remember and consider prenatal experiences, the identity issues we've talked about, and then the issues with trust. Those are significant. So let's talk about one particular way of thinking about it, which is blocked trust. So our kids who have had the experience of sort of consistently learning that they have to survive by being wary of caregivers or the world around them, essentially build that wall up, right? Because that's what they have learned to do. So even when the person on the other side is safe and caring and consistent and meeting their needs, they might still be blocked to it because that was their defense. And so they get stuck in that phase. Now, with a lot of new experiences, with a lot of repetition, that wall can come down, or it can slowly open up, right? And then eventually. In the meantime, think about, like, just take a moment. Think about being in a relationship, parenting or otherwise, with someone who is not open to you, who is going to reject or not respond to your attempts to connect. Think about doing that maybe day in and day out. What happens for some of our parents with trying to parent kids with big challenges, big behavioral challenges, big attachment issues, is they can develop something that's called blocked care, which is essentially where the attachment system in their brain has decided this is too much. This is too painful. I am not able to keep trying. It is too hard. And so they get stuck in their own cycle of blocked care. And we really work hard with parents to, one, identify if they are in that space and share with us, because I know that's hard. That is really difficult to do. And I'm always so grateful when a parent can tell me very plainly that they do not like their child. Now, right? We don't want anyone to be there, but if they can say it to me and I can know that, then that means we can talk about it and I can try to get them some support. We can try to figure out how to work through it. It's the parents who are feeling it but not saying it that are going to struggle the most because they don't want to admit it. Of course they don't. I wouldn't want to admit that. That is really hard. So it's why we tell them that it exists. It's why we build the relationships that we attempt to build with the parents we work with so that they can feel safe to say that very hard thing, because it is hard to come out of. There is good news. Isn't that nice? um, and maybe some of you have experienced this in your own lives. But we can develop a secure attachment style. We can, like, it can change with a safe repairing relationship. A lot of you are probably familiar with Dr. Bruce Perry. His work is, so central to all the things we've talked about. And I do like this quote from him, that relationships are the agents of change and the most powerful therapy is human love. He also said that our kids can learn the language of attachment, but they might always speak with an accent. So the idea is like, yes, they can, like, they can learn it, they can do it, but there might always be this layer of sort of what was there before, and it might flare up sometimes, right? It's like when I'm really tired and my very nasally Michigan A's come out. I'm a Midwesterner. You might have picked up on that already. But sometimes they really come out when my capacity is low. I haven't lived there for a long time, so it kind of has evened out, or maybe not. Maybe that's a delusion. But it's a layer that's always there. And so we have to remember that. And so that parents don't get discouraged if there's a flare up of an attachment challenge, even if they've worked through a lot, because that's okay. So before we move on from attachment, are there thoughts, questions that folks want to share? Anybody? Okay. If things come, we can get to it. Okay. So there we go. All right. So given all of these challenges we've talked about a lot, so given those, how do we help parents, give our kids what they need? Or depending on your relationship with a kid, how do you maybe use some of the skills we're going to talk about in your interactions? So some general guidance includes, always thinking about safety and security and how we send those messages, and remembering that it's not just about physical safety, it's about emotional safety and what feels safe to them, felt safety. Noticing and tracking trends. Some of you might have encountered this. Some of our kids have times of year that are really difficult for them. So it could be that in a particular time of year, they experience significant trauma. So when you get up to that time of year, you're feeling it more. And for our kids who might not understand that, they are going to be having more challenges, and they don't know why. But maybe parents, or again, someone who's been in the child's life for a long time, like you, because sometimes you're the more consistent figure than a foster parent if it's a child who's circulating through families. And so maybe you'll be the one who sees, you know what, man alive, every time July comes around, like, we just have this blow up. So, and you don't even have to know why. You don't have to be able to pinpoint, like, oh, this is what they experienced in July. You just have to know when we're gearing up for July, we have to be prepared. And depending on the kid's age, we can also have that conversation with them. Like, listen, July's a really hard month for you. And I don't know why, maybe you don't know why, but we just know, like, these past few years, July has been hard. So, like, as we're getting closer to it, like, let's think about what we can do. And if they're not that age where you can have the conversation, or they might not be open to it, we can still proactively decide, like, okay, what are things that help with this child's regulation, and how do we build them in or get them, like, bolster their supports during that time? So notice and track trends, especially in times of day, right? So a lot of our kids really struggle when they get home from school, often because regulated all day, and it has taken so much energy. And if I'm a child that's struggling with just sort of with any sort of mental health challenges, with any learning challenges, like that's just exhausting. Navigating the day is exhausting. And so if we know that that's the case, let's build in some regulating things when they get home from school, as opposed to just being annoyed. um, Acknowledge positives wherever you can, in a genuine way, right? You don't want it to feel fake, but if you can, that's great. And then, as much as parents and kids can, practicing in calm times. So if you have a child who's consistently running out of the classroom, let's say, well, we're not going to be able to talk about that at the time that it happens. But in other times, you're like, oh man, okay, I know, like when you get upset with your teacher, all you want to do is run out of the classroom. And if you haven't been able to work with the school to allow for an exit, because that is always an option, but I'm not going to get off on that tangent right now. We're just going to stick with the example. Plan separately what they would do and not just making a list, like do it, right? So if I'm upset with my teacher, first thing I'm going to do is squeeze my lip fist really hard and then let them go slowly. And then we're going to do it 5 times. And then I'm going to take 3 really big deep breaths. So let's do it. So, and like literally go through the whole piece multiple times. And we all know the things that are habitual for us are the things we can do even when we're in a panic state or when we're sleepy and we have less capacity. Like we can access those if they've been ingrained. And so that's the idea, is getting them as ingrained as possible so that when I have less capacity, I can still reach for it. It's still something that pops up for me. Compliance is different from cooperation, right? Cooperation is mutually meeting the needs of both individuals. Compliance is typically fear-based and focused on the needs and desires of the more powerful person. So this is a dynamic that parents can often fall into where they just want compliance. I get that. Like that would make everything easier. But you know what we can't do? Control another person's behaviors. As much as we would like to, we do not have that ability. So how can we avoid those power struggles? How can we take a problem-solving, cooperative approach? And I'll say it now and I'm going to say it again. It's not that we don't have consequences. It's not that kids don't need boundaries. They do. Those things have to exist. But how we do them does matter. I'm going to see how many of these we can get through. I might go through them kind of quickly, but I'm happy to do any follow-up that would be helpful. So thinking about what's going on underneath the behavior and thinking about skill or will, because the reality is sometimes it is a capacity issue. It's not an oppositional choice a child is making. It is genuinely capacity. They lack the skill. If I have a flat tire, no amount of will in the world is going to let me change that flat tire if I don't have the little, I don't know how to change a tire, but have the, the doohickey thing that you need and the whatever you need. It doesn't matter how much will I have. If I don't have the little jack to get my car up, I cannot change that tire. And so we have to have the skill and the resources we need in order to be successful. And that is true for our kids. So what sends our kids into survival brain? Fear, again, which we won't always know, or threats of harm, which we might not be able to interpret, raised voices, a chaotic environment, rejection or perceived rejection. We're going to come back to that one on the next slide as well. Failure or perceived failure. Trauma reminders, which again, we might not be aware of. And then just think about anything else. And some of these we've talked about already, these more sensitive buttons that our kids have, right? They're going to be more prone to being upset by rejection, abandonment, embarrassment, failure, sharing. I know that seems odd, But asking me to give to someone else can be really hard. If I don't feel like, one, that means I don't have control over it. Two, it means it's not mine anymore. And that is maybe important to me, that things are mine. Boundaries and consequences might send them up, as well as others. And again, it's not that they can't avoid all of these things, but how do we help them through it? How do we help them through it? So we want to approach it with curiosity instead of control. Why not try something new instead of more of what's not working? We love a do-over because it's an acknowledgement of like, maybe that wasn't your best moment, but you can try again. So instead of just being mad, like, don't give me that attitude. Be like, let's try that again. Like, what's another way you could say that? Which means I have to stay in my upstairs brain. I have to be regulated in order to do this. Because if I'm coming back at them with a, let's try that again, that's not helpful. Can't be sassy while doing it. But like, let's try that again. Or if a kid is coming at you with like, I don't know, I want a snack. Great. Like, I would love to get you a snack. While I get that, could you maybe think of another way to ask me for a snack? I don't love demands, but I love a request from you because I'd love to get you a snack, right? So like using some playfulness, giving them an opportunity, modeling instead of just going in with a, like, that's not how we ask for snacks, can be really helpful. So reframing the behaviors that we see is also really important. So this is one resource that we like a lot. It's from Riley the Brave. It'll be on a list I'm going to send you of books. And the reframe is that a child is having a moment, right? So if I am very prickly, then I'm having a porcupine moment. I am not a porcupine, right? It is not all of who I am. It is a moment I am having. And our kids have a lot of moments. And so reframing them as such gives language to it and takes shame out of it. So thinking about the way we help to regulate our kids, we talked about last time, right? It's that regulate and then relate and then reason. Again, the push and pull of consequences, we do encourage parents to try not to take things away that are helping a child with their healing and their regulation. And so sometimes, no, we don't take away karate as the consequence. And I know that's hard because, like, well, they don't deserve to have karate. They don't deserve to do this. And like, if it is a thing that is helping with their journey, their journey of healing and their regulation, which from a big picture perspective is going to get us farther along, then let's think about not taking that away, because it's only going to set us back. There are a variety of parenting approaches that we share with our parents that can be helpful. We talk a lot about PACE. We're doing an upcoming training on PACE. I listed a few here, as well as Love and Logic. We do a Love and Logic series every fall. I will quickly go through PACE, but I also send the slides so you guys will have this. But it's using these components when in not necessarily, it's not like a step by step. It's just using these components in different moments. So playfulness, acceptance, accepting what is behind a behavior or emotion, even if we're not a big fan of the behavior, or how they express the emotion, we can accept what's behind it. We can be curious, again, be that behavior detective, and then show that empathy. It is you and me against the problem, not you against me. We encourage our parents to Q-tip. Frankly, we encourage all of ourselves. Something we talk about in the office. To Q-tip, not take it personally. And for me, what that means is it doesn't mean that I shouldn't have a feeling. So like if a kid is rude to me, it's okay if I feel hurt by that. Like, that's okay. But here's my example. So the 16-year-old I mentioned is a little less surly now, but was having some surly moments, in particular at the end of the school day, because their school day was very difficult because of their own mental health challenges, and navigating the day made them really, really tired and overstimulated. So I would pick them up from school and we would be driving home and I would ask questions, trying not to over ask questions, but just ask like a few questions. And I would get, basic one word answers and then silence. And I had to learn to not take that seriously, even though not take it personally, not take it seriously, not take it personally, because it wasn't about me. It was about where they were and what they needed at that moment, which was a quiet car ride. It wasn't about me. It wasn't because they didn't like me or not were annoyed by me. It was just they needed a quiet car ride. Okay. So I will not have time to go into all of this, but we'll send it out, and I'll send it out with, we have a sort of like a tip sheet for like questions to ask therapists so that parents can get a sense of their areas of expertise. The primary thing that we share with parents is that talk therapy and cognitive based therapies like your classic CBT, they're not going to work so well for all of our kids because they need what we call sort of bottom up, if we're talking about like the brain perspective, as opposed to top down. They're going to need perhaps movement therapy. They might need play therapy, even if they're 15, right? Going back to that 15-year-old we were talking about, they might need play therapy, right? They might need equine therapy. Well, that's a lot of talk therapy. That's a lot of talk too, but they might need different approaches. And so we often set up our kids for failure by putting them in with a support that is not appropriate for them because that's not the capacity that they have. I'm going to skip through all of these and share them with you. I am going to send you a book list. I'm going to highlight a few people that if you are not aware of, not following, I highly suggest that you do. Angela Tucker is an adult adoptee who was adopted transracially. Her podcast, The Adoptee Next Door, is fantastic. She's got so much. I realize I just need to hurry. Robin Gobel, like if you are not if you are not familiar with her, I would get familiar with her. Same with Jessica Sonarski. She has amazing resources. She is local, which is also super helpful. Some of you might know this, but Sesame, they have a lot of amazing resources. So they have these tough topics. And so you'll see it listed here. It helps with language, it's resources. So I encourage everyone to check it out. I will send you a list of suggested readings. And the reality is, there are these significant core issues that we need to be aware of, we need to provide support for. And there's a lot of resilience in our kids. So I am going to end with this quote because I like it a lot. So some of you might be familiar with Elizabeth Kubler-Ross and her stages of grief. So the most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depths. These people have an appreciation, a sensitivity, and an understanding of life that fills them with compassion, gentleness, and a deep, loving concern. Beautiful people do not just happen. So that is it. I do apologize for the rush at the end. I'm happy to stay on a few minutes if anyone has any questions, or I'm happy to, if you want to reach out to me and schedule a separate conversation, happy to do that. So.
Awesome. Meg, thank you so much for doing this. We really appreciate it.
Absolutely. My